Thanks once again for being here this afternoon. I'm Nathan Hobble. I'm the Director of Behavioral Services and Projects here at the Virginia Department of Behavioral Health and Developmental Services. We're going to do this presentation today. It's not going to take the allotted time. I think probably 30 to 45 minutes. And we're going to do some information on BSPARI review updates. Before we dive in, just a little bit of housekeeping. Brian mentioned just a couple minutes ago, we're going to record the training. And of course, the goal is to get that out as quickly as possible. Once we have that training link available, we'll email it to everybody that registered for this. And we will also get it posted on our website. As noted on the previous slide, we've got closed captioning that's available. If that's beneficial, go ahead and you can activate that. If you run into any issues, please use the chat as we go through this presentation. And I just wanted to let you know, for questions that you have, we have done our best to produce proactive questions and answers, essentially trying to think about, if we were receiving this information, what questions would we have? So we're going to do that proactive Q&A kind of at the end. Throughout the training, just go ahead and type any questions that you have into the chat. We always get a lot of really nice questions with these types of events. Usually there's commonalities in the questions. Today, we're not going to field questions live. Instead, we're going to collect any questions that you have from the chat. We're going to type up responses, and we're going to get those answers back out to you as soon as possible after the holiday. So please don't hesitate to type any questions that you have into the chat. Again, we'll collect them. We'll provide written responses after the meeting for all that are here today. That also makes it a little bit easier for folks that are trying to view this webinar that are not here in person and looking at it later on. So we'll have the webinar, the slide deck, and any Q&A put together in an email and also posted on our website as quickly as possible after the training. I've got our contact information listed here. I'm going to do intros to some of our new team members in just a couple of minutes, but I've got the email addresses there, and we can link those in at the end as well. And I just want to note, this is just more of an informational training about our process and sharing some data. It's not a continuing education training, so it shouldn't be used for those purposes. Here's a quick agenda. This is what we're going to cover. I'm going to do quick intros for our team members. I'm not going to put them on the spot and make them say anything. I'm just going to tell you who they are and show you a picture of them. They can come off and wave if they want to, or type something friendly into the chat to introduce themselves. So we'll do that here in just a second. We're going to review BSPARI results data over time. I'm going to give some information towards the end, which is kind of the bulk of what we're going to be talking about on our feedback process and just forecasting what I'm going to speak on. We're going to be asking the behavioral provider community to revise and resubmit any behavior programs that are not meeting criterion on the BSPARI, which is actually a very small minority at this point, and I'll talk about that when we look at the data. So more to come on that here in just a couple minutes. And again, we're going to have some proactive Q&A. Go ahead and use the chat if you have any questions. We're not going to do live questions here, but we'll put together written responses after the training and get them posted on our website. So I am super thrilled to give quick intros to our new team members here at DBHDS, Courtney Pernick, John Tolson, and Nick Vanderberg. Most of you have probably interacted with me or Brian Phelps, my colleague, who's also here today. And I have to express gratitude to Brian for helping to manage this webinar for us. And a big thank you to Brian for everything else he does here at DBHDS for our team. So now we've got 5 team members in our small band of behaviorists, if you will, and what we're calling the Behavior Network Supports Office here at DBHDS. Believe it or not, across our group, we've got close to 100 years of combined behavioral science experience. Our team members have worked in homes, community settings, schools, on military installations, clinic-based settings. with youth and adult populations. So again, I'm just super excited to have all these folks here, the 3 new team members to join the work that Brian and I have been doing and the work that Sharon and I started a couple of years ago. So it's just a quick intro to put a face to a name, and you can be on the lookout for correspondence from them at some point in the future. I'm sure paths will cross. And this is a somewhat unrelated announcement, but I'm really pleased to announce that DBHDS is now a continuing education provider through the Behavior Analyst Certification Board. So what does that mean for us and for you? Well, if you have board certification through the BACB, we can provide free continuing education units to you that you can use towards maintaining your credential. If you're a positive behavior support facilitator or another licensed professional that delivers therapeutic behavior consult, we can also give you a certificate for attending future continuing education events that we provide. But it would be your responsibility as the practitioner to make sure that the content that we present actually passes muster with the requirements for your endorsement or license. So as it stands now, our team's working on several trainings. So we'll just put this in the stay tuned category for an announcement soon on future free continuing education opportunities through our network. All right, so I've spoken on the BSPARI and how it came to be, I think probably in most of the presentations that I've done around our quality assurance efforts. So I'll be pretty quick on this. I assume that most participants are familiar with the settlement agreement between the Commonwealth of Virginia and the United States Department of Justice. There are many different stipulations in the settlement agreement, a small number of which are related to behavioral services. And I've talked in the past about grouping the particular efforts for behavioral services into 2 different categories. One is getting people connected to the service in a timely manner, and the other is what we're going to talk about today, quality assurance of behavioral programming that happens through the DD waivers. So several years ago, we updated regulations to outline the content areas of behavioral programs, and we also created a very in-depth practice guidelines for behavior support plans. We also cooked up this tool that we call the BSPARI, the Behavior Support Plan Adherence Review Instrument, and that measures adherence to those practice guidelines. That's got a 40-point system, 0 to 40 weighted points, and we set a criterion for being in adherence with the practice guidelines at 34 weighted points or above. So that equates to approximately 85% or better. We've been doing reviews since January 2022. The way that we select the reviews is based off of a statistically significant sample that's randomized and it's stratified across providers. So kind of what that means is if you work for a large provider organization, say where you are delivering services to 100 different people, you're going to have more reviews that happen through this quality assurance process than a provider that delivers services to maybe 2 or 3 people. Believe it or not, at this point, our little unit has conducted over 700 BSPARI reviews, and we maintain an inner rater reliability process, or just an inner score process, probably easier said, where we do blind reviews of another colleague's BSPARI results. So kind of what that looks like is if Courtney completes a review for John Doe, I may also complete a review for John Doe. I don't look at Courtney's score at all. I don't want to see it. I'm completing a review of the same documents that she did without looking at the results of her review. And then when completed, we compare those results, and we just do a total count inter rater reliability or inter score agreement. And our average is at 90%, and the median is at 89%. So pretty tight there with those 2 measures. And we are proud that we are looking at these elements that are on the BSPARI pretty consistently through the same lens. And that's the whole point of doing that type of process, to make sure that we're looking at things the same way. Part of the process that we've had in place is to provide an encrypted email that has scored copies of the tool. So if there's a batch of reviews that occurs, we try to get those out as quickly as possible. And then we offer a video feedback session where we talk about the areas that are in adherence with the practice guidelines honestly, what we find is that most of the time, the practitioners that are out there delivering the service just want to know about the things that are kind of not in adherence. But we're happy to point out both. And I'll just note that our process has been validated by the independent reviewer. That's the court-appointed monitor that was agreed upon by the Commonwealth of Virginia and the United States DOJ. So he and his team do very deep dives on all our processes, our data outcomes, and have given us feedback on what we need to do to make sure that we have excellent validity and reliability with the work that we're doing. We've got links here, and then Brian will pop those links in at the end. But if you want to do a deep dive on the findings that the independent reviewer, his name is Mr. Donald Fletcher, that he and his team have done over the past couple of study periods, please take a look. You can zero in on behavioral services, and then you could aerial out and see more about different areas of the settlement agreement that he's also reviewing. So feel free to take a look at that, and we'll get those links in at the end of the presentation. All right, so I want to share a couple of slides here on our trend data over time. So what we've got here are the percentage of BSPARIs that are in adherence. They're scoring at least 34 out of 40 points. I'm going to try this little zoom feature here so I can show you what the y-axis looks like. So that's just displaying, that's the percentage 0 to 100% of BSPARIs that are scoring at least 34 out of 40 points. What we've got here on the horizontal or x-axis, that's the reporting periods that we have where we're required to provide our data to the independent reviewer and his team. So these are just kind of like the batches of BSPARIs that were during this particular time period. We zoom back out. It's got on here a numeral. That is just the number that corresponds to the compliance indicator in the settlement agreement. It's irrelevant to the graph, but it's the same visual display that's put in this behavioral supports report that we turn out every 6 months. The target in the language for that compliance indicator suggests that 86% of the programs that we review need to be kind of passing the BSPARI, if you will. So what you can see pretty clearly across these 5 different reporting periods is that there's a nice ascending trend on performance of percentage of behavior programs that are meeting the criterion on the BSPARI, and by proxy being in adherence with the practice guidelines. And what I don't have on here, but I'll just describe verbally, is for the most recent report, and again, we'll pop this link in at the end of the presentation so you can check it out. We also just kind of put a cutoff for a plan that might not necessarily be fully in adherence with the practice guidelines, but we think it's a pretty adequate plan overall of 30 points. And we've seen a nice ascending trend there for that particular cutoff as well. The most recent report we did, 79% of the behavioral programs that we reviewed scored a 30 points or above. So it's super duper close to that 34 points. So the scores have really improved over time. And my point here with this is most plans are either at or they're very close to the cutoff score with what we set as criterion for being in adherence with the practice guidelines. So we're really proud of the work that everybody out there has done to align their behavior plan templates, their assessments, their graphing, and all the other deliverables with the expectations that we promulgated a couple of years ago. All right, so I want to do some funky stuff here and dive into the data a little bit more with some quick stats. So this is the same reporting periods. It's the same cohort or batches of BSPARIs across these reporting periods. But what we've got here is box and whisker representations, if anybody remembers that from undergrad or graduate school. If not, I'm going to give you a quick rundown on what it means and what it's showing you. This is just displaying these BSPARI scores again over these reporting periods. And the vertical axis is the BSPARI scores themselves, and it ranges from 0 to 40. As I said a couple of slides ago, The highest you can get is 40 and the lowest you could get is 0. We've never seen one that scored 0, but we have seen multiple that have gotten up to 40 at this point, which is fantastic. I'm going to pop a couple of visuals on here really quickly. These areas right here, that box that's in gray, that's displaying the second and third quartiles. So essentially like the middle half of the data set for those batches of Besparis that were reviewed during those couple of quarters. The whiskers that are on here, those are those lines that extend from those gray boxes. That's the lowest 25% down on the bottom, that lower green arrow, and then the top green arrow, that's the highest 25% of score. So that's the upper quartile, the fourth quartile. Just for illustrative purposes, moving over to the second box on whisker display because they're more outliers. Those are those scores that are numerically far off from the whiskers, essentially like the extremes. So what's interesting is in these data, all of the outliers are below the first quartile. We don't have outliers that are above. And then last but not least, we've got the mean. So the average is represented by an X. And again, those numbers that are displayed, those are scores. So the first batch of reviews that we did, it was 100 different programs that we reviewed. The average score was right around 26 on the tool. And we've also got on here that middle line that's on the box. That is the median or the middle number of scores. So let me clean all that off real quick. 1 second. So to me, what's this telling us? Just really quickly, I'm not a statistician, but I think you can look at this and you can observe some interesting kind of trends. So the range of the scores has tightened over time. So for example, the score range has gone from 6 to 38. So what's that, like 32-point spread to around 20. So it's gotten a lot tighter. The whiskers have gotten smaller. Makes sense. And the outliers have significantly improved. So the first lowest outlier that we had when we first did a set of reviews was at a 4, and then the lowest one we have now is around 17, 18. The mean and the median scores have also increased in each reporting period. Simply put, the data are moving in the right direction. So as said before, I just want to be clear, not an in-depth statistical analysis. You've got a couple of measures of central tendency here. It's not demonstrating any type of causation based off of all of our collective efforts. But what we have seen is marked improvement in scores since we all kind of got on this quality assurance journey together. And I say this with all sincerity. I'm super proud of the work that everybody out there has done. I thank you for the work that you've done to align behavioral program efforts that you're putting forward for people that need this service with the expectations that we put forward here at DBHDS and also through DMAS. So thank you so much. All right, so next steps. Where do we go from here? A key element that I think that we've been missing that can get us to this 86% of the plans being in adherence with the practice guidelines is revising and resubmitting programs. Sometimes we catch ones where we do a review the next year and we see improvement on the program. But what we really need to move towards is any behavior program that is not meeting the expectation on the tool to give pinpointed feedback and have a revision and a resubmit and a rescore. So what's the rationale? I think it's important to point that out. One is we set forth regulations and practice guidelines several years ago. We know that the elements that we put forward in the practice guidelines align well with best practice expectations. We've done research and published that information. We think it's critical that all plans meet or are very close to meeting this threshold. And for the ones that aren't, again, 80% of them are already at 30 points or above. It's just a little bit of tweaking that would get them in full adherence with the practice guidelines. Beyond that, the literature and our science tells us that rehearsal is important for skill acquisition. So revising a plan that's not quite at that 34 points gives the plan author an opportunity to kind of practice a little bit. You see that in the literature and BST, performance-based instructional design. And generally, it's a common thread in organizational behavior management literature. So I'd kind of summarize it as this: one component of why and the second component of why. It's more likely that the person with behavioral support needs is going to get those needs met, or at least that the program is set up to produce better outcomes if the program aligns to best standard practice of care. Additionally, if the program is not quite meeting expectations on the first review, there's another opportunity for the authoring clinician to rehearse that skill of on-target writing for plan elements. And we think very strongly that that's going to move us in the direction of achieving this overall goal that we have. So next steps, what's it going to look like in practice? We're essentially going to do what we've been doing in the past. We're going to provide these encrypted BSPARIs, and it's built into an Excel workbook. We send them as separate Excel workbooks in an encrypted email. We set up a video feedback chat based off of what works best for the clinician or the provider organization. So we're going to do that as per usual. If there are particular BSPARIs that are slightly missing the mark, we can offer more detailed technical assistance. We were pretty clear out of the gate that the intention has never been to provide treatment advice. That's way outside of the scope of what we are going to do or should be doing. But what we will do is provide resources. We can solution with you. We can give more information about what we're looking for a missing element. Sometimes there are situations that come up that are not specific to the person's circumstance or treatment that could be amenable for brainstorming, like help me with measurement ideas or something with training, or can't get this graph to work the right way. Can you help me out with that? We're happy to do that. So again, what we're gonna ask for, we're asking for your help on this, is just to resubmit that plan, revise it and resubmit it. And we'll talk about what that's going to look like a little bit more in just a second. But essentially, the plan author would make that revision, resubmit it to us, upload it into WAMS if that's easier, and shoot us a message, and then we're happy to pull it down. We're going to go ahead and review that revised plan again. We're going to rescore it on a blank BSPARI, and then we're going to get it back to you as quickly as possible, and can provide another feedback session if needed, just to kind of pinpoint these are the elements that were fantastic and good to go. These are the ones that need to be tweaked a little bit. All right, so in the beginning of the presentation, I told you that we did our best to kind of come up with, if we were receiving this information, if we were in the audience, what would be the questions that we would have? I want you to continue to go ahead and type any questions you have into the chat, but here's some kind of proactive Q&A. One that we thought might come up would be, if we need to revise a behavior program, can we bill for that revision? And the answer is affirmative. If there are hours authorized related to treatment planning and that work meets the allowable activities, there's the alphanumeric from the regulations, B2E, totally. You can and you should. Next question that we thought might come up, and this was one that's come up in the past, is actually related to the feedback sessions themselves. Can you bill for that? Unfortunately not, but again, if you're revising the plan and your work meets allowable activities, then you can and should bill for that if you have hours. We have done our very best to be mindful of folks' time, and we're going to continue to do that going forward. We thought a question might be, how long would I have to revise the plan? So general rule of thumb, we're hoping that it can happen within a month. That would be our target time, but we are absolutely going to be flexible with the team, and we will come up with an agreeable timeline based off of what works for everybody's circumstances. But we have to have some type of general idea of when we're going to be able to close the loop on them. We can't kind of have them hanging out there forever. So we hope that we can make it happen within 4 weeks, but we will offer flexibility. Another kind of proactive Q&A. If the plan doesn't meet criterion when it's resubmitted, do you have to revise the plan again? So my best answer is the whole point of all of this, with outlining these expectations and setting up this feedback cycle, is to get all of the programs to meet these acceptability standards. So yeah, it should be revised again, and you can resubmit it after that. We only have 5 staff members and we have hundreds of plans that we review. Now that we're adding on an extra layer of revising some small percent, or reviewing again, excuse me, some small percentage of revised plans. I'm not sure if we're going to have the bandwidth to review a plan a third time. It's possible, but this is the best answer that I have at this point. We would want you to revise the plan and make those adjustments. This has come up a few times, and hopefully I can give a good answer for this. How do you know what we're looking for in the plan elements? So the answer is we've got scoring instructions on our website, and the tool itself also provides operational definitions for each element. We made an update to the tool that's posted on our website, and again, we'll pop that in at the end of this little presentation here. But there is a third tab that's on the tool within the Microsoft Excel workbook. Get my laser pointer here. When I'm hovering over here right now, if you were to click on that, that actually has the scoring component. This has the resources that highlight. This area here that I've highlighted in yellow, that's what's got the definitions. So you could look at that, and if you wanted to know, what are you looking for preference assessment? It's going to tell you specifically what's the scoring criteria. That's what constitutes a check mark. So that's how you would know. You could also go reference our scoring instructions, but the same information we decided to just bake into the tool itself. So that's there. It's live on our website, and you can pull it down and take a look. This has come up a few times, and we actually welcome it. What if you disagree about the scoring of an element? We can't change scores on the SPARIs that we already provided in aggregate to the independent reviewer. But if we do find an error that we made and we haven't provided the score in aggregate, we're open to taking another look and potentially making an adjustment. We've done that from time to time. None of us are infallible. We're human beings. We review a lot of these plans. Sometimes you miss something. Sometimes you put a check mark and it's not actually there. You toggle the wrong selection on the tool. It's happened. It's one of the reasons that we tried to put in place, to the greatest extent possible, a relatively robust inner scorer process to make sure that we're seeing things from the same vantage point across reviewers. I know this one is going to come up. What if the score being below 34 points is totally outside of your control? There are situations like you did everything that you could do. You couldn't get any data. You tried very hard to get a consent signature, but despite your best efforts, you couldn't obtain it. People won't participate in training. My best thought is let us know about it and we can try to brainstorm solutions with you, but it's not always going to be possible. So in those situations, all that could have been done may have already been done, and that's what it is. That's okay. We know that this may come up as well because sometimes we review plans right now and a person has already discharged from services. So if that were to occur, what would be the next course for a revision on a plan that hasn't quite met criterion on the tool? I suggest if there are additional documents that you had available prior to discharge and we did not have those as part of the review, give them to us. And if they would help with us rescoring, then we can definitely do that. Otherwise, there is no plan revision, but still important to point this out. Take the feedback that's provided and generalize it to other plans. Even though that person's not still receiving services with your organization, we often see trends where if John Doe is a clinician and John Doe is really great at these particular areas, you see that permeate across behavior programs that John Doe is writing. And if there are areas that might need adjustment, things that might be missing, usually those are omitted across most of the plans that are penned by the same clinician. So in as much to say, there's a generalization component that could be captured there based off of feedback, even if the person is not receiving services anymore. Kind of similar question here. What if you're maybe like a larger agency and we give you feedback on a plan, but that clinician doesn't work for you anymore? So best answer for that is if the person's still receiving services with your team, but now they're with Jane Doe instead of John Doe as the clinician, the new clinician can still update the plan to ensure it's in adherence. But if the person's not receiving services anymore at all, then no plan revision could occur. But again, back to the proactive conceptualized answer I gave for the other question, there might be some generalization that could occur there. And when are we going to start doing this? We're going to launch this October 1st. that's not the date of when a behavior plan would be. That's the date that when we actually started looking at things here at DBHDS that you might hear afterwards. Here's a batch of Besparis. 4 of them are in adherence. 1 of them is slightly off. We want you to revise the one that's slightly off based off of the feedback. We'll work with you to come up with what's an agreeable kind of due date. And then once you send it back, we'll revise it and hopefully it's that criterion. What do you do if you got questions, you got concerns, you've got constructive feedback, positive feedback, any type of feedback about what we're doing here? Who should you contact? I'm the primary point of contact here as the director for the unit, but all of my team members welcome feedback. Feedback oftentimes kind of has like a negative connotation, but that's not the way that we think about it at all. It can be constructive, but it can also just be letting somebody know that they're totally on point with the expectation. So I welcome both types. Let me know if you agree with the path that we're on, or if you don't agree, and that's fine too. We welcome the feedback because it helps us determine where we're going and how the information and the work that we're doing is being received and the effectiveness. So that social validity component is really important to us as well. All right, kind of as we wrap up here, here's some references. Again, we'll get this posted as quickly as possible, the slide deck itself, so that you can click on the references, as well as access the links. We're going to leave this on for a minute while we pop some links that I mentioned into the chat. I want you to go ahead and type any questions that you have into the chat. Again, we're going to collate those. We're going to get them into buckets. We're going to get the responses out as early as possible in September. And while you're taking time to give us your thoughtful questions, we're going to pop these links in and I'm going to tell you what they are. We'll stop sharing my screen here. Ryan is already ahead of the game here. So the first link that he mentioned here was the practice guidelines for behavior support plans. That's the document that sets the bar for what the Bespari is evaluating. So go ahead and take a look at that. It breaks down all of the content areas and all of kind of the sub elements that we're looking at when we evaluate. Towards the end, it's kind of got 3 mini MINI literature reviews on trauma-informed care, positive behavior support, and person-centered planning and behavior support planning. And then there is what I hope is a helpful breakdown on authorization types, due dates, and deliverables. That's on page 15 of the practice guidelines. Brian also popped in these 3 reports. If you want to take a look at those, I'll just let you know they are hundreds of pages long, but you should be able to open them up and use the find feature to get to exactly what you might be interested in. So if you want to get down to therapeutic consultation or behavioral services, you can use that find feature and get to that information and see how we've been evaluated by the independent reviewer and his team and what feedback they've given to us that we've incorporated into the work that we're doing. We've also got the FY24 behavioral supports report. We do a report semi-annually, and that's what we provide to the independent reviewer in addition to any other information that he needs to have to evaluate the quality of the work that we're doing and to let us know if we're meeting the mark with the expectations of the settlement agreement. The next one that's in here is super important. If you're not familiar with it, this is our avenue to advertise trainings like this. It's the DS provider listserv that Eric Williams and his team in the Office of Provider Network Supports maintains. I'll let you know if you sign up for it, you'll get information that's far beyond the work that we're doing here with behavioral services. But you get information about town hall postings, you'll get information about other trainings, regulatory updates. So go ahead and sign up for that if you're not on there yet. I think we might just have a couple more things that we can share here. Yes, our website. So take a look at our website if you're not familiar with it. There are multiple different areas that are on there. We've got training videos that we've done. That's the location that this training is going to be shared on, as well as the slide deck and the Q&A. We write little snippets on there once a month that go into the Office of Integrated Health newsletter on different areas related to behavioral science. We have resources on there for practitioners, links to journal archives that are open access. So check that out. And again, I welcome any tips or feedback that you have about content that we should update, remove, or add to. And on the website itself, the scoring instructions are there. So you can click those, but there's a direct link in the chat. And then also you can download the instrument. You can get that Bespari workbook. Some practitioners have told me that they evaluate their own plans against it and that it's been helpful. So that is super reinforcing for me to hear that people are using it that way. That's my email address. We've got Courtney, Brian, John, and Nick as well as our team members that round out our quintet here. So I will just conclude by saying, once again, thank you for the time today. Really great attendance before we roll into a well-deserved holiday weekend. Thank you, everybody that's a practitioner, for the efforts that you've done to bring your programs into adherence with the expectations that we put forward in 2022. And please, please, please do not hesitate to reach out to me to give me feedback on what we're doing. Any questions that you have, I welcome it. I'm just an email or a phone call away. And we will get this information out with the Q&A that we see in the chat as quickly as possible after the holiday. So with that, I'll go ahead and conclude and say have a lovely, relaxing Labor Day weekend. And we will see you further on down the road.